Dear audience, thank you for coming today. Let me introduce my PhD topic, which is novel insights into the oral systemic health axis. My name is Ellay Gutmacher. I'm a first-year PhD student and fourth-year dental student. My supervisors are Andrea Brody and Akos Zhembri. My SMS is Petrana Martinekova. My statisticians are Silvia Kishdala and Gergely Agoc. My vision is to facilitate global healthcare by better understanding the oral systemic health axis, and my mission is to do it by providing scientific evidence that saliva is efficient enough to detect systemic diseases. Currently, we have 3 ongoing projects. 2 of them are meta-analysis, and 1 is a clinical observational trial. Due to strict time limit, I will only talk about the first 2, but the last one is evaluating the diagnostic accuracy of salivary C-reactive protein in neonatal sepsis. So allow me to introduce my first project, which is investigating the salivary levels of Fusobacterium nucleatum in patients with colorectal cancer by the methodology of systematic review and meta-analysis. The co-investigator for this project is Balint Jean-Borsaray, and this project has started in September last year. We know that colorectal cancer is responsible for more than 930,000 deaths per year, and it is estimated to increase to more than 1.6 million deaths per year by the year 2040. Screening tests such as colonoscopy can prevent early colorectal cancer by detecting malignant polyps and removing them. However, unfortunately, colonoscopy has its geographic barriers that contribute to the late diagnosis of the disease. In addition, it is an invasive, uncomfortable, and potentially it can harm the patient. As an example, in the USA, nearly 22 million risk individuals have never been screened for colorectal cancer. Fusobacterium nucleatum is an oral pathogenic bacteria that is also associated with periodontitis. It was found that the bacteria also accelerates carcinogenesis in different types of cancer, such as breast cancer and pancreatic cancer. Recent studies showed that the bacteria is found in colorectal tissues of patients with colorectal cancer and polyposis, and also that the higher the abundance of the bacteria in those tissues, the lower the survival rate of the patient. Therefore, we suggest a novel method to detect colorectal cancer by using saliva samples from which we can quantify the DNA levels of Fusobacterium nucleatum. Our vision is that risk individuals would be able to be diagnosed themselves from home using simple saliva samples, and by that, we provide an excellent tool to increase the detection rate of colorectal cancer. And this is why our aim is to investigate the diagnostic and prognostic value of salivary Fusobacterium nucleatum in colorectal cancer patients. So we ask, is there a difference between colorectal cancer and healthy or precancerous patients in the salivary Fusobacterium nucleatum DNA levels? To answer it, we use the PECO and the PERT framework. The PECO we used in order to investigate the association between the salivary Fusobacterium nucleatum and colorectal cancer patient, and we hypothesized that patients with colorectal cancer have significantly higher levels of salivary Fusobacterium nucleatum compared to healthy individuals as well as precancerous patients. And to investigate the diagnostic accuracy of the bacteria to detect colorectal cancer, we use the PERT framework, and we hypothesized that salivary Fusobacterium nucleatum can accurately detect colorectal cancer patients. We conducted our systematic search in 4 databases on November 25th last year with the following search key, as you can see on the slide, composed of 4 domains. And we started with nearly 14,000 studies and finished with 13 eligible full texts. So let me introduce our results. Here we investigated the presence of Fusobacterium nucleatum in the saliva among colorectal cancer patients and control groups. This is very important because patients with colorectal cancer usually show symptoms at the late stages of the disease. Early detection can open up more treatment options, and it also increases the likelihood of the successful outcomes, and by that it can save lives. So to assess the outcome, we use the odds ratio with 95% confidence interval. And here we included 5 prospective cohort and case control studies with nearly 2,000 patients. divided into two subgroups. The first subgroup is the healthy individuals, and the second subgroup is the polyposis patients. The heterogeneity was 0%, which is a very low heterogeneity between the studies. And the pooled odds for Fusobacterium nucleatum in the saliva is 43% higher in patients with colorectal cancer. And this could be clinically relevant. However, it did not reach the statistical significance. Our second outcome, in the second outcome, we investigated the relative abundance of Fusobacterium nucleatum in the saliva among colorectal cancer patients and control groups. Here, we assessed this outcome by mean difference with 95% confidence interval. And here, we included 5 prospective cohort and case control studies with nearly 700 patients divided into the same subgroups. And the heterogeneity was 2%. And the pooled mean difference is minus 0.02, which means that there is no difference between colorectal cancer patients and control groups in the relative abundance of salivary Fusobacterium nucleatum. So the strength of our study is its novelty. It focuses on a vulnerable population. We included individual patients' data that allowed us to interpret further the results into different variables. And also, we included studies from diverse continents. The limitations were the differences in measurement of salivary Fusobacterium nucleatum levels and the low numbers of the eligible studies. So based on our results, we can conclude that salivary Fusobacterium nucleatum is not associated with colorectal cancer. For the practice, we imply no difference between colorectal cancer and precancerous or healthy controls, neither in the presence nor in the relative abundance of Fusobacterium nucleatum. And for the research, we imply that more studies are needed, unified measurement of salivary Fusobacterium nucleatum level, and the effect of different microbiota and periodontal treatment on colorectal cancer has to be investigated more. And currently, we are at the step of risk of bias analysis. And let me introduce my second project, which is investigating the diagnostic accuracy of salivary procalcitonin in bacterial-induced systemic inflammation by the methodology of clinical observational trial. This project has started in November last year. So we know that bacterial infections infect more than 50% of the patients in the intensive care unit. Infections in those type of patients are associated with high morbidity, high mortality, and high cost. And the current used methods to detect the source of infections are the bacterial culture. However, it is a slow method. It can take several days to detect, to get an answer. And also, quite frequently, it gets contaminated on the way to the lab, which makes the sample inefficient. Therefore, diagnostic strategies to exclude the presence of infection are urgently needed. Studies show that serum procalcitonin is a very sensitive biomarker for bacterial infection, and by excluding bacterial infection, it can reduce the excessive use of antibiotics, and by that, it can also fight antibiotic resistance. And recent studies showed that procalcitonin also increasing in the saliva of patients with periodontal disease, and also during the acute exacerbation of chronic obstructive pulmonary disease. So our aim is to investigate the diagnostic accuracy of salivary procalcitonin for bacterial-induced systemic inflammation. For our first clinical question, we asked, how does salivary procalcitonin correlate with serum procalcitonin in patients with suspected bacterial infection? To answer it, we used the PECO framework to investigate the association between salivary procalcitonin and serum procalcitonin, and we hypothesized that salivary procalcitonin correlates with serum procalcitonin. And for the second question, we asked, could salivary procalcitonin accurately predict bacterial-induced systemic inflammation? For that, we used the PERT framework to investigate the diagnostic accuracy of salivary procalcitonin compared to bacterial culture. And for this, we hypothesized that that salivary procalcitonin can accurately predict bacterial-induced systemic inflammation. And our clinical implication is that salivary procalcitonin could indicate systemic bacterial infection and the need for antibiotic therapy. So to summarize everything, we plan to submit all of our project this year, and the first project in June in this year. And I would like to thank you for your attention with a quote from Albert Einstein: "The most beautiful thing we can experience is the mysterious. It is the source of all true art and science." Thank you.
The limitation of this study was that there were differences in measurement of the bacteria in the saliva. Why is this limitation?
Yes, thank you. Thank you for your question. So, during our analysis, there were a few studies that measured the salivary Fusobacterium nucleatum in different ways. The problem was to compare between those studies because first, some studies just used different technique to measure it, and they gave the units in a different ways, which were incomparable. And the other thing was that some studies used the same technique, but they compared the results to different reference gene, which also doesn't allow to compare the results. And this is a limitation because we could only include those studies that were comparable, unfortunately, okay, in the forest plots. But for the systematic review part, we will include the rest. Okay, use the other.
Were there a standardized sampling method, or they from the saliva, or they get samples from the periodontal pocket, or how did they achieve the samples?
Thank you so much for your question. So it's a really good question because we had a lot of different ways to measure it, but we decided to include only the studies that detected it from the saliva. So they just used the patient had to chew something that stimulated the saliva and then to spit it into a tube. In the forest plot, what we showed, we only included studies that they measured from the saliva, but we will also include different techniques such as a tongue biofilm and a periodontal filter cone in the systematic part.
There can be a variance in the bacteria flora regarding the geographic location. So do you know whether there's difference in its prevalence? As you have mentioned, you have studies from North America, Asia, and Europe.
Yes, thank you for your question. According to the results, we could not see any significant difference between the populations. There might be a difference between the populations, but we might actually analyze it. But currently, we analyze the different variables such as males, such as sex, male and females, and also the location of the cancer. But I think for our project, we don't have enough results for analyzing this one, but of course, I will take a look at it. Thank you for your question.